my students that made me aware of some data that exists, and that people are using to say that like COVID isn't that scary. This is why I think we need to, one, watch out for confirmation bias. So I'm gonna watch out for my own confirmation bias. Um, like there's I just hate that we live in this weird world now that like, it's like everything's become politicized. So clearly, I'm a scientist. I believe in viruses and viral load, and I believe that this disease is real. I believe the death rates, and I believe that. And then everybody keeps focusing on this table 3 conditions contributing to deaths involving coronavirus disease 2019 by age group, United States, and so forth. So, conditions contributing to deaths where COVID-19 was listed on the death certificate. So COVID-19, that we understand, is a respiratory illness. We know it causes pneumonia. So we know it's going to cause other respiratory diseases as well. So we got a whole bunch. The first thing they show are respiratory diseases. And this, I'm looking at the data. So let's just read the top here. Table 3 shows the types of health conditions and contributing causes mentioned in conjunction with deaths involving coronavirus disease. For 6% of the deaths, COVID-19 was the only mentioned cause. So that's the only mentioned cause. That doesn't mean it was the only cause. So you have a coroner and you have doctors that, write on paperwork, and, what they write in there is in general their best opinion of what caused the death. And the coroners are doctors too. And so, we're just looking for those kind of things. Like we're trying to ask, is this a good study? Is this a bad study? What's present in this study? So if COVID-19 is just the only death mentioned, and I'm a doctor, that actually might be me not doing my best job because I'm overworked. And I'm just, it could mean that like clearly that was a case of COVID-19, but what is a COVID-19 death without a subsequent, there's been like heart attacks and things like that, but without a subsequent cause? It's sort of like HIV causes AIDS, right? Is the virus that causes AIDS. Well, COVID causes that syndrome, and that syndrome has a lot but the syndrome isn't the only thing. It causes pneumonia. It causes other things. You can go check me on this. I'm totally okay with that. But I want to just give you my unbiased opinion here, or at least expose you to my biases. I do believe that the disease is real, and I'm clearly at home quarantining. So, I might have some cognitive dissonance if I don't see something there. But let's just try to process this with just data. And I love data. Data is my favorite. So, on average, there were 2.4 deaths with conditions or causes in addition to COVID-19. On average, there were 2.6 additional conditions or causes per death. Does that mean those are not related to COVID-19? I would love to see data on that. The number of deaths with each condition or cause is shown for all deaths and by age groups for data on comorbidities. So comorbidity for psychologists, right, is important. People with anxiety often have depression. Does that mean that they have two different disorders, or that they, I don't like the word disorders, but I'm going to use it today. Or do they have life stress that's creating both anxiety and depression? You can imagine being depressed and developing anxiety, or being anxious and developing depression. I'm not an expert in the clinical field, but I'm just trying to draw an example for our knowledge base. Now, okay, I do not know what ICD-10 codes are, but it looks like I don't need to know. These are just, if you wanted to look this up, that would be the first thing I look up. All ages, 0 to 24, 35 to 44, 23, 35 to 44, 45 to 54, 55 to 64, my mom's age range, very kind of scary for me, for her, older and older as well. Look, you can see just number one, total COVID-19 deaths as of, 8/22 to 2020. They're not saying they're not COVID-19 deaths. So these are the total. This is our baseline. We got 161,000 deaths in our society. Only 330 in most of my students' age range. I don't know all your ages, so I'm not trying to be disrespectful of my other students that might have a little bit of age on the youthful in our class. The age group below me, you can see the number of deaths jumped like 4 times. Doubles in my age range from 25 to 34 to 35 to 44, which I'm 39. So it jumps in there. And that really scares me. I don't want to die. I'm just going to be honest. There, I'm at home for that reason. But yeah, I'm pretty scared of that. Go up one more age range, it basically doubles from my risk, doubles again, doubles a little bit more, and then you get 14,000 more. You get about another, 15. I don't know. I'm gonna do the math. You can see that, and then another more. So basically, you got if you were to graph this, you would see very low rates of death for younger folks. But death isn't the only thing we care about. It goes up, and it goes up, and it goes up, and it goes up, and it goes up. And it goes up, and it goes up, but that going up kind of levels off at the end there. But you can see that. Let's look at these comorbid diseases: influenza, and pneumonia. Let's just see pneumonia and COVID-19. I know I should go to scientific databases, but I'm just trying to help us process this the way I would, I just want to see if I can get some quick data. But some who catch the new coronavirus get severe pneumonia in both lungs. The pneumonia appears to be caused by the coronavirus. So that makes, if we look at this, that's 68,000 people. Now, I'm not saying clearly influenza is a different thing. I really wish they had these split out. But right now, right, how many of these influenza and pneumonia deaths are influenza, and how many of them are pneumonia? So this is how you start to break down stats. That's a lot. That's it's about a third. If I'm doing 68, take 68 divided by 161. I'm not doing it for you, but here, I'll pull out I will do it for you. I love y'all. So I will go ahead and do this for you. I'm sorry, I'm going to be humming and hawing here, but this is how you process data. 68, I'm just being lazy, divided by 161. 42% are in the category where we know COVID's likely to cause pneumonia. Too bad they don't have influenza mapped out so we could see if we're in the middle of an influenza outbreak. I'm going to go COVID and lower respiratory diseases. Respiratory virus infections. If you start reading about this, how respiratory illnesses harm the body, that's not even a good website. But basically, journals. So it looks like lower respiratory tract. I'm finding a journal here. Coronavirus causes lower respiratory tract infections less frequently than RSV in hospitalized Norwegian children. So I do not know what is that respiratory syntactile viruses. But so it says it causes it less than RSV in these kids. But it also does, they're arguing it causes lower respiratory infections. And clearly I'm not an infectious disease expert, so I'm just trying to get my best information here. Adult respiratory distress syndrome. Here, let's go to Google Scholar. Let's do better searching. I'll show you better methods. So chronic lower respiratory syndrome. Okay. And I'll put COVID in there. See, look at this: acute respiratory distress syndrome caused by COVID-19. It's in the title, right? Okay, so now I'm seeing, possibly 70,000 plus 13,000 plus 21. That's one I just, nope, plus 13,000 adult respiratory distress. Let's try this one. Adult respiratory distress syndrome. Right, you're going to get something here, outbreak, COVID, reported, blah, blah, blah. We know that. In an acute resolved disease, but as of February, the case has been confirmed. However, no pathology has been reported due to the barely accessible autopsies or biopsies. Here we investigate the pathology characteristic of a patient who died from severe infection with severe acute respiratory syndrome, coronavirus 2, by postmortem biopsies. The study is in accordance with regulations. Our findings will facilitate understanding of pathogenesis. So it looks like, this is not my field. This is not like, I'm not like super math oriented, super biology oriented, but what am I noticing? COVID causes respiratory problems, and a majority of these are respiratory problems here. And then you got some circulatory disease, hypertensive diabetes. You're going to be at risk if you get COVID and you get that. That's going to increase your rate. Ischemic heart disease. Again, probably the origin didn't exist with COVID. Cardiac arrest, that actually is one we should look up. Cardiac arrest can happen all different times. I'm just going to see, can it be caused by COVID? Since the media on this is all, y'all were telling me what the media said, and I'm seeing that people aren't looking at the data, and that's honestly what I see, y'all. But I don't know here. I'm gonna read a little bit about this. COVID-19 doctors are told not to perform CPR on patients in cardiac arrest. This is a very sad research project right now that we're doing. I'm gonna BMJ, that is, I used to know this one. Let's see what they found. So this looks like it doesn't look like science necessarily. Maybe I'll go here. It's HTML. Okay, so they got cardiac arrest outcomes among patients with COVID-19. Let's just read the results. Data from 136 patients showed 119 patients had a respiratory cause for their cardiac arrest. Okay, there we go. That takes out another big chunk of this right here, cardiac arrest. Hypertensive diseases. Oh, did I read that as diabetes earlier? I'm sorry. My eyes are kind of a little funky sometimes. I don't see everything perfectly. And maybe it's in the brain. Maybe you can tell me. But hypertensive diseases, hypertensive, that's a pre-existing condition. But 50% of people a lot of people have pre-existing conditions. I've heard 50%, but we should look over that. Heart failure, right? Does heart failure, well, now we're getting to some of the smaller ones. Let me see what, I don't think it's going to call it hypertensive. So, but still, that, I think it's what we call an interaction in our field. We can agree that some of these people with hypertensive disorder might have died in the near future, but also they're put under a lot of stress by the disease. So I don't know if these are people who tested positive or what. They're not telling us that. And that's a good question. Like, what percentage of these folks did test positive for the disease? But ultimately, I do believe that, I don't believe in the major conspiracy theories that doctors are elevating the rates of death. I don't find comfort in that. I read a recent article about people really that adhere to conspiracy theories, and this is in Psychological Science from like a last month. These folks have a tendency to really seek out order, and they when something's just done with random chance, that's not ordered. That's not comforting. It's actually more comforting for some people to believe a conspiracy theory is leading to something that was an accident, and like a disease transmission from one species to another species. That's an accident. And we need to realize that. Sepsis, that's diabetes, obesity, Alzheimer's disease, right? Like, those are pre-existing conditions. Sepsis, though, what is sepsis? This is not going to be a fun Google search. So I'm going to stay in Google Scholar. I do not want to see pictures of this. Sepsis and COVID-19. Guidelines on management of critically ill adults with COVID-19. Surviving sepsis. So it looks like, let's read the novels. SARS-CoV-2 is the cause of a rapidly spreading illness. We know it has COVID disease, COVID-19, affecting so I guess the virus is SARS-CoV-2. The disease is COVID-19, affecting thousands of people around the world. Methods: we formed a panel of 36 experts from 12 countries. So this is just a panel discussion. I'm not excited about that data, but let's see what they say. We searched the literature for direct and indirect evidence on the management of COVID-19 in critically ill patients in the ICU. We identified relevant and recent systematic reviews on most questions relating to supportive care. We assessed the certainty. This is their methods. Feasibility recommendations were strong or weak or in the form of best practice recommendations. The surviving sepsis COVID-19 panel issued 54 statements, of which 4 are best practice statements, 9 are strong recommendations, and 34 are weak recommendations. No recommendation was provided for 6 questions. The topics were 1, infection control, laboratory diagnosis and specimens, hemodynamic support, ventilator support, and COVID-19 therapy. So, sepsis appears to be in part related to getting this disease, according to those doctors. Late onset neonatal sepsis in a patient with COVID-19. This is a case study. It looks like they're showing us the sepsis over here. I'm just gonna have to Google sepsis for myself even. I think I know what it is, but I just want to see. A serious condition resulting from the presence of harmful microorganisms in the blood or other tissues and the body's response to their presence, potentially leading to malfunctioning of various organs, shock, and death. So you're in the hospital, you're getting poked. Sepsis happens in the hospital. You're in the hospital for COVID-19. So now you're starting to see that I'm just trying to look it up with you, right? I am a scientist. I believe in science. I don't believe in the conspiracy theories. But also, this is what we, like, if I wrote a paper like this and said, 6% of deaths of COVID are due to, only 6% of deaths in COVID are due to COVID. Or if I wrote a paper like, only 6% of racism is due to this factor, and I did something like this, I would lose respect and credibility. Some of these are clearly pre-existing conditions, but were they going to die today of Alzheimer's? These are questions that psychologists ask. Was it just coincidence that they had COVID and Alzheimer's, or was there an interaction? Same thing with diabetes, right? Diabetes with the circulation in the blood and the breathing and all that important stuff. Obesity, I think, as well, right? What does that mean? Technically, when I look at the scales, I technically, with my height and my weight, meet the definition of obesity. So I don't know, are they defining it by that definition? I'm not a huge fan of that one. Renal failure, we could look up renal failure. We could look up vascular and unspecified dementia. Right, that's one. Okay, what's vascular and unspecified dementia? And the question we're really asking here is, was this an interaction with COVID-19, or was it, just existing at the same time? And I think that's a real important question. Caused by COVID-19. I just want to see if it's possible to be caused by COVID-19. This is what you could call confirmation bias, but I'm also telling you exactly what I'm doing. I'm just saying, is it possible? Do we have any evidence that this is caused by COVID-19? We do have symptoms, complications of COVID-19 in 153 patients. I'm just going to click on that one. Methods. I'm going to go to the results. Oh, wow. Okay. Even me, I don't like reading these things either sometimes, folks. Let's go to the interpretation. To our knowledge, this is the first nationwide cross-specialty surveillance study of acute neurological and psychiatric complications of COVID-19. Altered mental status was the second most common presentation, comprising encephalopathy, which is, I think it's water. I think this is what I think it's like water in the brain, like water surrounding the brain, but I'm not perfect. It's definitely inflammation, something like that. Not my area. I'm just trying to help you understand. Or encephalitis and primary psychiatric diagnosis, often occurring in younger patients. The study provides valuable and timely data. So now we know that people with COVID-19, I mean, you can look at the data too and see what the scientists are doing, but a lot of these, when I'm looking at it, are associated with COVID-19. So the argument that we don't know much, I'm going to challenge that. Look at how much I was able to find published on COVID-19. COVID-19 science is fast-tracked. We don't know as much as we know about the flu, but we know quite a bit. And so I just want you to see that. This, to me, this interpretation of this is complete bullshit. And you can look it up yourself. In order to prove me wrong, what do we need to know? Like, okay, and this is a good thing as a scientist, right? It's like, okay, if I'm wrong, here's when I'll say I'm wrong. Like, I want influenza pulled out of the pneumonia, right? And I want to see the death rate for influenza versus influenza with COVID. Is it an interaction with influenza and so forth? Pneumonia. I want to see the pneumonia because COVID-19 causes the pneumonia. If I'm really doing this, I'm going back to the doctors and saying, look, was this pneumonia caused by COVID-19? Just because there's another list of death on the death certificate, like what we do in science is we find chains of causes. So COVID, the SARS-2, I forget all the name of the virus, leads to the COVID-19 syndrome. The syndrome leads to influenza. The influenza leads to death. Influenza is a very serious, pneumonia leads to death. The influenza I want to pull out, but I also want to know death rates for influenza with and without COVID-19, right? With and without the virus even. Chronic lower respiratory diseases, yep, expect those. Adult respiratory distress syndrome, expect those. Respiratory failure, expect those. Respiratory arrest, expect those. Other diseases of the respiratory system, yep, expect those. That's 60, that's 70, 80, 90, 100, 150. Oh, people have more than one disease. Look, I'm adding these up. Like I got like 150 and they have 161 total. So like that means people have more than one disease. So I don't know how many people have this disease and only this disease, right? But like, look, 60,000, 70, 80, 90, 100, 150, 155, 158 plus a little bit of change, right? 158,000 people had respiratory diseases that very well could have been caused by COVID-19. Right here is the big question mark with the influenza. But my question is there an interaction? Circulatory diseases, we found cardiac arrest. I didn't look at all of them, but I'm going to guess like severe pneumonia probably leads to heart failure. Severe respiratory distress can lead to heart failure. If you're not getting any oxygen and your heart needs to beat faster, guess what? Failure. Sepsis, you get that from the hospital. I don't know everything. Diabetes, obesity, Alzheimer's came in with those. COVID didn't cause those, but interaction. Diabetes and COVID, worse death rate than COVID alone, worse death rate than diabetes alone, right? Probably. Alzheimer's disease, I watched step-grandfather pass of this, and, that lack, the loss of a lot of that thinking and memory, but that planning ability too, that makes for a shorter life. Renal failure, we could look up some of these other ones, but right now what we're seeing is that a lot of these diseases are associated directly with COVID-19.